Hi, this is Dr. Tessie Lim, board certified dermatologist practicing here in the province of La Union. So, for the topic for today, I decided to go pathologic. So, it says eczema. So, I'll read you this flyer because tinataman ako mag-isip ng content. So, I think this one can be a basis for my content. So, what is eczema? Eczema is a general term for dermatitis that results to red, itchy, and inflamed skin which at times may blister, ooze, or peel. It is a common condition yet largely manageable. Although eczema is interchangeably used with atopic dermatitis, there is a difference between these two. In fact, there are several types of eczema, namely atopic dermatitis, considered severe and long-term, contact dermatitis, dyshydrotic eczema, nummular eczema, seborrheic dermatitis, and stasis dermatitis. So what are the difference? So usually if you have atopic dermatitis, there's a history of atopy. Either the patient has one, pag sinabi namin atopy, that's asthma, allergic rhinitis, and the like. Either the patient has those, that the history of those, or relatives has. Yun. Then, next one is, along with the skin lesions, of course. The next one is contact dermatitis. There are two types of contact dermatitis, either allergic contact dermatitis or irritant contact dermatitis. But allergic contact dermatitis, it usually takes time for it to appear on the skin. Mga 24 to 48 hours bago siya lumabas. As opposed to irritant contact dermatitis, immediate yung reaction niya. Agad after you're exposed to the irritant, we already have the skin lesions. What else? Dyshydrotic eczema. Dyshydrotic eczema, from the word itself, it's hydro. It's like having like blisters or bule sa kamay. May mga paldos sa kamay between the fingers of the hands, sometimes the toes. Nummular eczema. Nummular is like, they have point-shaped lesions on the legs. Seborrheic dermatitis. Seborrheic dermatitis, usually lesions appear very scaly and oily. It appears on the face, sides ng nose, eyebrows, back of the ears, scalp. Sometimes, if it's more severe, it can go up to the chest, upper chest, and then the back. Next is stasis dermatitis. This is type of skin conditions usually associated with vascular problems. So we usually have to have some tests done to confirm. They would have like these ulcerated lesions on the legs, depending on which kind of vessel was involved, if it's arterial or venous. So, is eczema contagious? No. Hindi ito nakakahawa. Eczema is not contagious. So, who is at risk for this? Eczema is frequently affect children, mostly during the first 2 years. So, mga bata talaga. Should it develop between ages 2 and 5, the eczema tends to be more persistent. In adults, it occurs in up to 4% of individuals. While it is rare for the first episode of it to occur in adulthood, it could turn out to be chronic if it does. So, ibig sabihin kapag mas late lumabas yung manifest yung mga skin lesions, hindi during childhood, mas matagal pa siya. So, parang mas lifetime yung mangyayari. What causes this? The exact cause is still undetermined. However, the following risk factors or combination may lead to flare-up. So, number 1, yung genetics. Number 2, environmental triggers. So, it really depends where you're from, what your environmental triggers are. So, what are the example of this? Pollution and other allergens that are triggering your eczema, especially atopic dermatitis. There are a lot of triggers. Poor hygiene and sometimes vaccines. So, the visible part of the skin, called the corneal layer, continuously renews itself and protects the body from germs. With eczema, this layer is unable to provide ample protection due to damaged skin caused by inflammation or the lack of moisture. So, what are the symptoms of this? It may differ from person to person, okay? So, the common signs are itching. So, makati talaga siya. Makati. Which could worsen when the skin is inflamed or scratched. Meaning, kapag kinamot mo pa, mas mangangati pa siya. Next is drier, sensitive skin. So, very scaly skin or sometimes tuyo lang talaga. So, makapal na yung scales because it's very dry. Red, inflamed skin. You really see that it's thick because it's red. Dark colored patches of the skin. This means it's mas matagal na siya kaya nangitim na. Rough, leathery, or scaly patches of skin. This one is more chronic pa. Blisters that easily break and leak and eventually crack, crust, and thicken. So, for example, atopic dermatitis, there's a chance for it to have an infection because when the patient keeps scratching on the lesions, kakapal siya, tapos magkakaroon ng mga excoriations, redness, and then could have an infection, and that's why there's some blistering occurring. Swollen areas. In babies, eczema commonly appears on the cheeks, arms, legs. In children, teenagers, and adults, it often shows up on the back of the knees, inside of the elbows, and the back of the neck. However, it can appear at any part of the body. So there's a certain site of predilection. As a dermatologist, we know which eczema it is that we're dealing with based on where it appears. But there's some exceptions. Minsan sobrang dami, you really don't know na eh. So it's best to really have a checkup with a board-certified dermatologist. Next is, what happens if I scratch the affected areas? It is natural to scratch the itchy skin. So, makati talaga siya eh. So, I wouldn't be surprised if you do keep scratching it. But it is essential to avoid getting caught in this cycle, which could worsen eczema and result in complications. So, superficial wounds due to scratching could leave the skin vulnerable to infection, which may have to be treated with antibiotics. Meaning, sa kakakamot mo, baka kailangan mo na ng antibiotic na gamot. So, huwag masyadong kamutin if you can. Just really don't scratch it. How is it diagnosed? So, if the rashes that resemble the eczema develop on any part of the body, especially the type that recurs, consult a doctor, a board-certified dermatologist. He or she will perform a physical exam to first rule out other possible skin conditions and determine if it is indeed an eczema. So, maganda talaga magpa-check up sa board-certified dermatologist para alam nila kung ano yung problema sa balat. So, how is treatment? What is the treatment? The treatment for eczema will depend on severity and age. So, ang ibig sabihin nun, depende talaga yung ibibigay na gamot sa inyo sa severity, kung gaano kalala yung sintomas. And doctor will recommend the ideal regimen based on his or her assessment, which includes over-the-counter therapies like moisturizers, cleansers, soaps and shampoos, prescription topicals like steroids, calcium urine inhibitors, phosphodiesterase inhibitors, skin barrier creams, and so forth. Phototherapy is also a consideration. UVB light radiation, which can also be used to manage these conditions. Systemic medications for moderate to severe cases, including certain antihistamines. So what are non-steroidal topicals? So non-steroidal topicals, also known as topical calcium urine inhibitors, which are applied to areas of the skin affected by the eczema. They stop parts of the immune system from overacting, thus preventing eczema like itching and redness, unlike steroids. It can be used for extended periods of time to relieve and reduce the symptoms. So, there are other options kasi baka ang alam lang ng karamihan na topical steroids lang ang medication for this. There are other options